arthroscopy indications are evolving, and we don't typically use it for arthritis pain. Some of the more common indications for hip arthroscopy are damage within the joint, such as labral tears, cartilage damage, synovitis or inflammation within the hip joint, as well as treatment of muscle and tendon injuries around the hip joint. Patient selection is probably the most important aspect of hip arthroscopy. It begins with getting a good history, a detailed history from the patient about their complaints of pain, timing of and the nature and location of the discomfort that they're having. We then correlate that with the physical exam that is performed in my office by a surgeon, by myself, and then obtaining x-rays to assess the level of damage that's within the hip. If there is an indication, then I'll obtain an MRI of the hip as well, and putting all these things together, then we'll determine if the patient is a candidate for arthroscopic hip surgery. Surgery may be the best option for certain patients for hip arthroscopy, but it is always the last option. We always start a patient's treatment with non-operative but conservative management, and this is in the form of activity modification, physical therapy, cortisone injections, as well as non-steroidal anti-inflammatories. Hip arthroscopy tends to be an outpatient surgery. Usually patients go home the same day after the operation. And for myself, I usually get the patients going on physical therapy almost immediately. Usually within 24 to 48 hours after surgery, I have them on a bicycle to minimize scar tissue. Shortly after surgery, you'll be in crutches and using a brace, and patients may use those until they have a normal gait pattern and then discontinue use of the crutches. In some procedures, which may be more extensive, we may use the crutches for up to 6 weeks. As far as long-term prognosis, patients usually start getting improvement shortly after surgery and may continue to improve between 3 and 6 months after the procedure. At UPMC, you have full access to fellowship-trained surgeons in hip arthroscopy. Furthermore, hip problems are not always within the hip joint itself and may require referral to a spine surgeon or to a general surgeon, and we have access and referral sources to direct that patient towards that in a very easy fashion. Furthermore, we have the state-of-the-art equipment here to do hip arthroscopy, which does require specialized instrumentation for the surgical procedure. And finally, we have research that we're doing here at UPMC based on hip problems, hip damage, as well as how to improve our labral repair techniques.